What up, fellas? It's Ty. Welcome back to the channel where we discuss all things prostate and prostate cancer related. If you're new here, welcome to you. Been here for a while, maybe watched the video, maybe even liked and subscribed. I appreciate you. And welcome back. So today I want to talk to you all because in a lot of these videos I've talked about the radical prostatectomy and getting and choosing the radical prostatectomy, and that's just because that's the option that I chose. But it's very important to me that I tell you all that I looked at all of the options. So in another video, I talked about the difference between the radical prostatectomy and radiation and active monitoring. And I talk about how I looked at all of them and I said, you know, I did all of this stuff and I realized that radiation wasn't for me. But I want to be clear with you all. I didn't just get to the radical prostatectomy just because. I know that I told you that I didn't want to do anything and that's what I selected. But I just want you all to know that I did my due diligence. And so I want you all to do the same. I actually had a consultation with the radiation, the people that do the radiation. I actually accepted the consultation. I went in and they actually told me all of the things that go into radiation. So when I talk about me asking those questions and me coming back and saying that I knew that wasn't going to work for me, that wasn't because I was talking to my doctor who couldn't extend or expound on how much radiation, where it goes, how it works. That's not his job, and it's not necessarily what your surgeon will do. So if they give you the option of going to talk to the people who do the radiation, go talk to them. Because what you'll find is maybe you're going to have your radical prostatectomy first, right? If you're going to have that first, you may at some point end up having radiation, and you might want to make sure that you know what's going on. Again, make sure that you know all of the options that are available to you so you can make an informed choice, because that's really what I'm doing the videos for. I want you all to make informed choices. I know that you may not have the time that I had to do all of this. You may have bigger families. You may have bigger responsibilities. And so I'm giving you tips. Jump in, and be able to say, hey, you know what? Ask your doctor this question. Because again, I keep saying that all surgeons don't have to be great. So you want to make sure that you're holding them accountable. In order to do that, you need to know as much as you can about the processes that are available. All right. So take the meeting with the radiation people, go talk to them, let them explain to you exactly what's going to happen. Ask the questions that you can there. Then formulate whatever questions you have for your surgeon for outcomes. Because remember, you always got to ask an outcome question to your surgeon and to the radiation people. And then once you finish that, then you can make an informed decision. Or at least that's how I made the informed decision, that radiation wasn't going to work with me and that I was going to have to select the radical prostatectomy and deal with the outcomes that come from that. All right. I hope this finds you well. I hope this is helpful. Peace and blessings, fellas.